Hello, everyone. My name is Bukola. Welcome to this virtual webinar of the next installment in the Adolescent and Young Populations Partnerships and Webinar Series. The Adolescent and Young Population Key Partnerships is a joint venture of youth networks and UN agencies with the goal of strengthening the youth-led responses with respect to the needs of adolescent and young key populations. Under the leadership of the Youth Rise and Lighthouse Vietnam, this webinar series was conceived to support conversations and knowledge sharing amongst youth networks, activists, and advocates on topics that are important to youth-led networks. Today, we'll be discussing adolescent and young key populations-led advocacy, challenges, and lessons learned for youth leadership. A few housekeeping rules. So we'll have all of our Q&A at the end of the session. Please use the Q&A button to ask your questions for our speakers, and we'll do our best to get to them. So hi, my name is Bukola Renola, and I will be your host and moderator today. I am a UNICEF intern working with the Adolescent and HIV Health Program Group. We have a very packed program filled with learning about key strategies, perspectives, and tangible frameworks that can help us to advocate for the fulfillment of the rights of adolescent and young key populations, including those in the most marginalized in the most constrained settings. So without further ado, I would like to first introduce our speakers. First, we'll have Mary Okoli, who joins us from Abuja, Nigeria. Mary is a feminist activist, global women's health, rights, and empowerment initiative. Mary will speak to us today about the important intersections in advocacy work and their work working with young key populations. Next, we'll have Yobra Darif, who is a young LGBTQIA+ activist joining us from Rabat, Morocco. Founder and executive director of Roots Lab Africa Plus, regional coordinator of the Simba Middle East and North Africa region. Yuber Darif will share key advocacy strategies and tactics that they would recommend for youth-led organizations navigating closed and constrained contexts. Next, we'll have Ralph Ivan J. Sampson, RN, President and CEO of YPair Philippines, joining us from Mandaluyong, Philippines. They will be sharing their country experience utilizing the Uproot scorecard for ayKP-led advocacy and accountability to influence policy processes. And finally, last but not least, we'll have Tina Purnat, who is currently a doctoral candidate at the Harvard T. Chan of Public Health and a Purnat Leadership Fellow and LGBTQ Health Voices Fellow. Tina led WHO's infodemic management efforts during COVID-19. Tina will be sharing their perspective on the frameworks, logic models, and theoretical frameworks that might help us understand, as well as unpack misinformation, disinformation, as well as hate speech. She will also be sharing some touch points and unique entry points for protecting adolescent and young key populations within the HIV response. Now, I would like to invite you to introduce yourself in the chat. We want to hear from you, so feel free to share your experience, comments, where you're from, feedback, as well as question in the chat box, and we'll do our best to get to these. So without further ado, we have our first speaker, Mary Okoli.
Hi everyone. So glad to be in the section. Hi everyone online. I'm so happy to be here today, and I'll be talking around the importance of intersection in the advocacy work for young key population. And the young key population group I'll be speaking specific to today is female sex workers. sex workers in their diversity, and then the LBQ plus persons, LBQ plus sex workers. And I'll be looking at some of the challenges that young female sex workers experience, especially in reproductive health, violence, and economic vulnerability, as well as not leaving behind or making emphasis on the additional layers of discriminations that and challenges that LBQ plus persons, LBQ sex workers face as a result of exclusive healthcare services, economic empowerment, and then violence and discrimination in the society. We all know that Nigeria, as regards to LGBTQI rights, has passed a bill on the Same-Sex Prohibition Act, which really limits a lot of programming and a lot of implementations for LGBTQI persons in general. And then looking at the fact that we're now talking about young persons. So next slide. So I'll be talking about the intersection of health and human rights. Here, as an organization and then as a young key population in Nigeria, one of the basic things that we do in terms of addressing issues or intersection of issues for young key population is prioritizing healthcare access and human rights, understanding that healthcare access is a human rights issue for everyone, is a human rights need. So we make sure as an organization and as a young activist in the country to prioritize access to inclusive, non-judgmental healthcare services, including sexual and reproductive health. We also see how we could work with other health organizations, public health facilities to make sure that they continue to provide tailored services and holistic care as much as possible. And also we safeguard the rights of our young key population. We continue to advocate, we continue to campaign both virtually, physically, the rights of LGBTQ sex workers in general, and how they can work safely without discrimination. We continue to challenge societal stigma, and we continue to advocate for their fundamental human rights. And then last but not the least, as regards intersection and human rights, we continue to empower choices. We ensure that our sex workers in their diversity have autonomy to make informed decisions about their health and well-being. So we empower them to advocate for their own needs as much as possible. And we don't do that not looking at the fact that it is young sex workers, young LGBTQ persons who are within the organization. We don't have, so we're saying that what we do is more inclusive to say that young persons are the ones who continue to empower, who continue to advocate for their own needs by themselves, right from the grassroots level. Also, the intersection of economic and social protection. We continue to provide vocational training, education, financial literacy programs to create alternative income generating opportunities for our sex workers and LGBTQ persons in their diversity as much as possible, to make sure that young persons have alternative sources of income, and then they have power. They are not influenced by power over. They are not influenced. There's this thing we talk about when we work with our community that says no sex, no condom, no sex. And then so for that we prioritize alternative sources of income so that you're not influenced because of the huge sum of money that a client is offering you, and then you want to now have sex without condom. No. That's the autonomy that we're talking about. And then we do that through some levels of alternative livelihood support programs for young key population. Then the intersection of gender equality and prevention. One of the things we do, we continue to address the issue of gender-based violence and exploitation. We challenge stigma. So we conduct awareness campaigns to challenge these societal stigmas and misconceptions surrounding sex work, surrounding LGBTQ sex work, promoting a greater understanding and acceptance of this community. And that can be seen in one of the documents as an organization that we work closely with partners to develop for the state where we currently implement a local, we at local level, Benue State, and currently Benue State has an SRHR policy that is all inclusive of key population. You have drug users, you have representations of the LGBTQI community, you have the representation of sex workers, people in confined spaces, people with disability. Their voices were addressed in that SRHR policy that Benue State is currently using and implementing. Then we also do community mobilization. We continue to engage other grassroots organizations, community leaders, gatekeepers to address these unique vulnerabilities faced by our community, young sex workers in their diversity, and then we continue to foster collective action for change. Then in terms of legal support, we have developed programs that offer legal assistance, counseling for young sex workers in their diversity that probably are faced with issues of violence, and then or they are victims of exploitation. Then I will talk about holistic protection. We continue to implement strategies that addresses the intersection of gender, sexuality, sex work to safeguard LBQ and sex workers from violence and exploitation. We continue to hold spaces for the community. And then last but not the least, the intersection of policies and community engagement. So for here, just like I said in my earlier words, that as an organization, we work closely with an international partner that supported the development of an inclusive SRHR policy in Benue State that is currently being used. So intersection of policies and policy advocacy and community engagement. So as an organization, as a young key population, we work with policymakers to develop and implement very inclusive policies to protect the rights and addresses the needs of sex workers in their diversity. That's LGBTQ sex workers, LGBTQ sex workers with disabilities, and the rest. Then community dialogues as well is one of the ways we work. Organizing community-based dialogues and forums to reduce stigma, increase understanding, amplify the voices of sex workers in their diversity, both at the grassroots level. We engage gatekeepers, brothel owners, bar owners, and the rest. Then grassroots partnership. We all know that advocacy is a collective voice. If we go one, we will go faster. But if we go together, we will go further, because it's not how fast you go, but how well you can make an inclusive voice to address the need on the change that we want to see. So grassroots partnership is one way that we work in intersections of advocacy. We collaborate with grassroots organizations, community leaders to ensure that our advocacy efforts are informed by lived experiences of our community members. Also, talking about safe spaces and community buildings and empowerment. So as an organization, we work as much as possible to establish safe spaces, support group meetings for young key population, that's young sex workers, LGBTQI, to be able to share their experiences, also access resources, receive peer-to-peer support. And then we continue to foster the development of strong support networks and communities that don't only celebrate the unique identities and experience of our community members, but they are strong allies to the voices and needs that we continue to seek for. And then we continue to empower our community members to embrace their identity. We continue to advocate for their rights. We even make them see role models within the communities as well. So I would say that the advocacy for young sex workers in their diversity, that includes LGBTQ individuals, are motivated and addressing the health, human rights, economic empowerment, gender equality, policy engagement are all intertwined. We cannot address one and leave one behind. So for us, recognizing and acting on these intersections helps us to be able to create more supportive and inclusive environments for young key populations. Thank you very much.
Thank you so much, Mary, for that beautiful presentation. Next, we're going to have Uber, who is going to be talking to us and answering a question on what are the key advocacy and strategies and tactics that you would recommend for youth-led organizations navigating closed and constrained contexts.
Thank you. Thank you so much. So I will start directly by tackling the question in the way I think it's really important to inform you and to also let you know what's going on and what's happening in those contexts. So instead of taking a government or a well-established registered organizations, we took the example of a youth-led grassroots unregistered organization, which is the organization I work for and I co-founded. So without any introduction, so about the context, uh, the social and cultural context in Morocco is characterized by a stigmatizing and conservative discourse seeking to shame diverse sexual orientation and gender identities, expressions, and also all the key populations like people using drugs, people living with HIV, sex workers. So this is very known in our context, and this is translated really to harassment in the streets, online, by sometimes by government uh, and aggressivity towards key populations here in Morocco, encouraged also by law, like Articles 483, 489, 480, and 521, I think. So yes, a lot of articles about sex work, about public decency, about a lot of things that constrains our existence as young key populations, but specifically as young LGBTIQ persons. For Roots Lab, actually, we understand how difficult is our context, and we try to approach it with a specific vision, which is instead of putting the focus on the context itself of the criminalization and our identities that are really under questioning, under arrest, and everything, we direct our focus to Article 19 in the Constitution, which states that the right of life is the first right of any human being. And from that, we created a platform which is like an intersectional feminist community-based led working or organization working on LGBT and gender development to promote equity, equality, and freedoms in our country, aiming to build a network of gender diverse people who are capacitated, informed, and enabled to contribute to the development of their conditions as LGBTIQ persons in our diversity through empowering our beliefs, structures, processes, and trying to co-create our narratives by ourselves, because we know that it's really difficult to in this context. So we do that through empowering LGBTIQ persons by providing access to alternative ways of education, because we know that many of our people, persons from our community have a lot of challenges in order to pursue their education. So we try to provide an alternative by doing workshops and also working on what we need in order to enlarge the amount of uh, gender diverse people who are capable of advocating for themselves and for their issues. Through that, we also try, in this context that I was speaking about at the beginning, but we try to not to neglect it, because we know it exists. We know we are taking risk, especially as unregistered structures, organizations, community working together. We are not legal because we are working on a sensitive topic. So we are trying to create partnerships and collaboration to collaborate with community-based organizations, allies, supporters who can amplify our voices, our impact, and ensure that we can at least be sustainable. And for that, for example, we did a lot of collaboration with grassroots feminist movements in our country, but also in our region, which is North Africa, and also with the Middle East. And we try to also to work on research and documentation studies to collect evidence, because we know it's a strategic tool for our advocacy and influence the policy making processes and policymakers. So we are trying to prove that we are not harmful to anyone, we are not harmful to the country. The contrary of it, we are resources and very talented, and we can do a lot of things. So we need our space to empower each other, to engage, and to be part of the development of our country, especially that we know that by 2023 there is Morocco will co-host the World Cup, and we don't want to repeat the same mistakes as what happened in Qatar. So we are trying to collaborate with the government, especially in those conditions, because we know that there is a lot of international pressure. So we are trying to navigate this context with a lot of awareness. And for that, we also work on promoting or empowering people who are able to innovate. So by fostering innovation within the movement, by encouraging innovative solutions to gender related issues that we are facing on the local level. And for that, we created a sort of fund which is not really, it's just like, it's not registered as well. So it's like the community we gather, and we just try to have our resources, our personal resources, and try to support each other. And for that, for example, we supported the first event of a local organization called Queer Art, which is like specified in queer in art, in queer art, like queer people doing their art and trying to advocate and trying to navigate this context. But also we worked with or we supported or helped the founding of an organization also that is trans specific, in working on south and in central and southern Morocco, because we know that in also as Roots Lab, it's not. Yes, we just want to correct something. I'm not personally in Rabat. I'm currently in Marrakesh, and we are working from Marrakesh in Agadir, because we believe that a lot of resources and a lot of things happening in Rabat, Casablanca, and places in Morocco, but others are not really don't enjoy those privileges. So we are focusing our work on those parts of the country, and for that we supported the creation of, or the foundation of a trans-specific structure that speaks for by trans from from local trans people, speaking from themselves and trying to voice themselves at least on the national movements, and be considered in this in what's going on, in what's happening in our country. Actually, we had so many events that we did, and we have so many collaborations. Many of We take the risk to have to be funded, because it's a risk. Since we are not registered, but also we are hoping to find ways to be registered. Currently, we are thinking about working on something like a production boîte de production, which is like something that works on art, but like doing art, because when you do art, it's less judged, and even if it's judged, it's art. So we are trying to work on navigate this challenging context with a lot of understanding and awareness about who we are as Moroccans, and how can the country operate in terms of social or government, and also as a community, living a lot of struggles and a lot of things in our daily lives that makes us really difficult to navigate even each other. So we are trying to provide safe spaces, and that's really what we do the best, or what we yeah, that's what we do the best, is that we are trying to provide safe spaces where people can gather, exchange, work together, and try to provide alternatives and share their visions and maybe work on initiatives, because we believe that even that we are a good amount of people, but it's not enough. It's not enough. So we are trying to support each other and trying to, in order to navigate this context, because we know if someone of us is touched, we are all, because we are all together in this, and we are out and loud, and we have to be aware about how we take our steps in order not to end up in situations that are difficult, like being in jail, or being in difficult situation in general. So yes, this is how is the context. We try to be positive in this presentation. I try to be positive in this presentation. I didn't work on it alone, so it's a team effort. And yes, I think that's it. And I hope I didn't took much of the time, and I'm on time, and will be really happy to uh, hear your questions in the Q&A section, and in the part that is allocated to that. Thank you so much.
Thank you so much, Uber, for your presentation. Next, we'll have Ralph, who will be talking to us about kind of their own country's experience utilizing the Uproot scorecard for ayKP-led advocacy and accountability to influence policy processes. Take it away, Ralph.
Hi, hello everyone. I'm trying to check whether my presentation is visible already, Bukola.
Yes, we have your presentation.
I'm trying to open my camera, but I can't open it. Anyway, again, good afternoon, good evening, everyone from the Philippines. It's already late at night here in the Philippines, but thank you so much for inviting me here to share our work. Yeah, okay, the camera is already working. Thank you so much for inviting us here to present our country experience, particularly on using and utilizing the Uproot scorecard. And also thank you so much for other young people who have been sharing your spaces with us to present this presentation. So basically, the Uproot scorecard is being led by Y Plus Global and the PAC with the support from UNAIDS, and we are very much happy to be part of this Uproot Scorecard 2.0, which was actually conducted way back in 2002. So because of this Uproot Scorecard, YPR in the Philippines were able to develop programs, particularly to address those identified gaps that were identified and as part of the result of the Uproot Scorecard. And one of which is the Comprehensive Sexuality Education on Adolescent Reproductive Health, or CSE ARH Convergence Program for Alternative Learning System. So here in the Philippines, we do have formal education, but one of the most vulnerable group of young people are actually out of school youth. And our government has an existing program that could reach them through our Department of Education under the Alternative Learning System. So in partnership with the Department of Health and the Department of Education, with funding support from UNICEF Philippines, we were able to implement the CSE Convergence Program for Alternative Learning System. So for this program, we actually have health component and education component. So it's actually one of a kind program wherein as far as we increase the demand generation, particularly in accessing comprehensive sexuality education, including HIV, is also we wanted to make sure that health services are readily available. So currently, we are very much happy to share with you that we already developed the Teaching Learning Resource Package, or we call it TLRP, on CSE ARH with the Department of Education. This module will be used by the Ministry of Education in order to implement CSE, particularly for out-of-school youth. Last May also, we had our field validation and pilot testing with our ALS teachers and in selected cities, particularly in Angeles City and Cagayan de Oro City, both in northern part and southern part of the Philippines. So right now, we are on the process of finalization of our TLRP, and hopefully, we will be doing the nationwide capacity building training of our ALS teachers for them to roll out our CSE. So basically, part of the approach scorecard indicator that was asked actually is the availability of our CSE. So because at that time, CSE was not really implemented in the Philippines due to COVID-19, but because of the approach scorecard, we were able to, develop programs that could help us support the idea that there's really a need to, implement CSE. So apart from the education component is we really wanted to make sure that the health services are readily available. That's why for the health component, we were able to provide technical assistance to support our local government unit in the establishment of an information and service delivery network, or we call it ISDN, particularly on adolescent health and development, which actually paved the way for the referral pathway. So through this ISDN, with different key players, not just for health, but actually for other non-health concerns and agencies providing non-health, particularly social protection, employment, and other issues faced by young people, we were able to develop an operational guidelines. So these guidelines actually guide our local government unit on how to refer cases, including gender-based violence, sexual exploitation, and among others. So because we always believe that the HIV concerns and rising cases of HIV does not only talks about engaging into risky sexual behavior, but there's other underlying causes, including sexual exploitation and gender-based violence. So right now, through this health component, we were able also to develop a training package on adolescent mental health. So it has been, the government already, or there's an existing policy on mental health here in the Philippines. There are also different modules on mental health, but for this project, we were able to develop specific training package focusing on adolescent, which actually talks about understanding teen brain, adolescent brain, and also capacitate our healthcare workers on how to address mental health among adolescents, because it's really quite different compared to mental health for adults. Also, through this health component, because as part of the indicator in the approach scorecard is the access to knowledge on ASRH and HIV. So with that, we were able to also work with our government to develop a national standard on peer education module. This is actually an ongoing project with Ministry of Education and Ministry of Health together with our National Youth Commission. And this coming July, we will be sitting together with other UN agencies to identify what are the standard in terms of peer education, and what are the non-negotiable key messages that would guide our community-based organizations, development partners, and local government units in terms of conducting trainings related to peer education. And also it includes competency-based criteria in making sure that in the delivery of peer education, we have a very specific indicators whether peer educators is delivered effectively, and at the same time it is being monitored by our government. And lastly also is as part of the approach scorecard is increased stigma and discrimination coming from the healthcare workers. So for this health component, through the approach scorecard, we were able to include capacity building of our healthcare workers, particularly in providing adolescent-friendly health services, to make sure that our health facilities are providing adolescent-friendly health services, and making sure that our healthcare workers are capacitated to understand, walk through, and to work with our volunteers. Apart from this CSE Convergence program, because of our development of different proposals through the joint program on accelerating the reduction of on adolescent pregnancy. It's actually JPARAP. It's funded by it's actually a joint program between WHO, UNFPA, and UNICEF here in the Philippines. It's funded by KOICA, or the Korean International Agency Cooperation. We were able to leverage or ask them to develop this adolescent-friendly mobile health facility. So right now, I'm very happy to share with you that we already have these adolescent-friendly mobile health facilities, and we were able to what do you call this one? Conduct the ceremonial turnover to our provincial government in Western Samar and Southern Leyte. So basically, this adolescent-friendly facilities aims to, bridge the gap of increase stigma and discrimination in the healthcare facilities, and also making sure that the services are being delivered in the grassroots level, particularly in geographically isolated and disadvantaged area in the different parts of the country. So it also includes in the upward scorecard about accessibility of health services. So through this facility, at some point, it does not necessarily address entirely the accessibility, but at the very least, we were able to bring the services outside the facility through this mobile health facility, or we call it Track Kabataan. Second one also is that when we talk about accessibility, it has been a long time struggle here in the Philippines in terms of accessibility, because currently many of our laws are quite discriminating for adolescent, particularly in accessibility and provision of health services for adolescent among minor. However, we were able to develop this concept of the Orange Hub, because basically our branding is orange, so we call it Orange Hub rather than calling it the usual Youth Hub, because when you call it Youth Hub, it's quite there's already an attached stigma to it. So we are trying to identify other ways and means to make our service delivery more catchy and more fruitful in some way by playing with the colors and the idea around. So we were able to develop this concept note, the Orange Hub. So basically, it's a comprehensive and innovative adolescent health facility designed to address the unique needs of adolescents, particularly those young adolescent aged 10 to 14 years old, wherein we don't also have the data yet. And I guess many of our colleagues will agree that if we want to end HIV, we have to invest more to younger generation, particularly 10 to 14 years old, because this is the time when they explore and they start to engage into risky sexual behavior at the same time. So this Youth Hub is actually a one way to round up, escape, or something like an alternative way to deliver the services, because currently our Supreme Court has an existing temporary restraining order prohibiting our government facility to provide health services among adolescents. However, the temporary restraining order by the Supreme Court does not cover private entities, including us. So through this Orange Hub, it's a private entity run by young people ourselves. We see this as an alternative way to provide and to continuously provide life-saving information and services among adolescents. And also, we continuously, provide capacity building to our healthcare workers, particularly on community-based HIV screening. That's why we are very much thankful to Youth Lead Asia Pacific and other regional youth networks who have been very supportive in providing grants or small activities for us to continuously conduct community-based screening. This is quite very important to us, particularly for our peer educator, because we are very hard on peer education, but we also realized that after peer education, many of our adolescents wanted to access the services, but none of them are trained on CBS or community-based HIV screening. So we have to make sure that our peer educators are also HIV screener or motivator for them. After providing peer education, they were able to provide the HIV services right after the peer education. They don't need to go to the facility because, even a single hour might change the mindset of our ayKP. So we have to make sure, time is quite very important element in providing health services. And also with our healthcare workers. So we work closely with our government to make sure that our work will be more sustainable. And right now they have seen the importance of working with community-based organizations like our member organizations here in the Philippines. That's basically one of the few things that we already done, but I'm not sure, and I hope all of you, I will be able to invite you to come here in the Philippines, because Philippines is a tropical country where we have so many beaches. We have it should be a dream destination for many of foreigners. But apart from being a dream destination, Philippines is one of the most country with a rising HIV, and we don't want that to happen in the near future. And we have to work on how do we see Philippines as a dream destination, and we have listed these few things that we are actually dream of, particularly on pre-exposure prophylaxis for minors, because currently we don't have the guidance yet, and our government is quite hesitant. But I hope we could start to talk about pre-exposure prophylaxis for minors. Also, we are dreaming to have a nationwide capacity building training for our ALS teachers, as I have mentioned in my first slide, in order to roll out the CSE in the entire Philippines. Also, we wanted to work on youth participation in climate change and disaster response, because here in the Philippines, as much as we work so hard, we've been facing another layer of challenges, particularly on climate change and disaster preparedness, as part of the volcanic or the Pacific Ring of Fire, and we've been experiencing majority of the disaster, earthquake, typhoon, and so many others. So we want to make sure that our community-based organizations are ready to make sure that HIV services are continuously being provided even during humanitarian crisis. And also, we wanted to professionalize peer education as part of the healthcare system, because peer education is quite very important to increase the demand and meeting the target of ending HIV in 2030. With the previous administration, we had a very difficult time to discuss drugs because of the extrajudicial killing by the Duterte administration. But hopefully although it's our president is the son of the former dictator, but we see a thin light that we could somehow talk about harm reduction, particularly for adolescent and young people using and injecting drugs for this administration. And lastly, we dream of a country wherein we have a HIV treatment, care, and support for children and pedia. So I mean, like the Uproot Scorecard help YPeer together with our community-based organization to support our government identify key priorities that they could work on. I'm not saying that you will address entirely the problem. That's why we have to work with other organizations, may it be development partners, may it be UN agencies, because we don't also have enough resources and funding. So that will be all. Basically, the Uproot Scorecard was conducted way back in September 7 in 2002, and we did it in a hybrid because of the COVID-19 protocol. And we actually it was participated by 15 participants. 10 of them are online and 5 of them are on site, and they are coming from the key populations all over the country. So right now we're using also the Uproot Scorecard in working with our Philippine National AIDS Council, with our Global Fund to Fight AIDS, Malaria, and Tuberculosis country coordinating mechanism. And lastly, I saw a colleague here, Darren Paul from Y Plus Global. We work together with kapatid Darren, particularly engaging PEPFAR and USAID to develop Youth Advisory Board to make sure that their HIV response is adolescent friendly, and it reflects the needs of adolescents. And that is because of the Uproot Scorecard that was part of the recommendations during the activity. So I hope I was able to inspire, and I do feel and also acknowledge the struggle of other community-based organizations in different parts of the country. I hear you, Yuba, and I hope we could have a global solidarity with other community-based organizations who have been struggling to, reclaim their spaces. But you are not alone, and we are here. And thank you so much for the UN agencies for always supporting young people. Back to you, Bacola.
Thank you so much, Ralph, for your presentation, for sharing your country's experience, showing the beautiful pictures. I really learned a lot. So thank you so much for that presentation. Last but not least, we have Tina Purnat, who will be answering the question, what are your perspectives on the frameworks, logic models, and theoretical framework that might help us better understand and unpack misinformation, disinformation, and hate speech, and also touching on some touch points and unique entry points for protecting adolescent and young key populations within the HIV response. So take it away, Tina.
Okay, great. Hi, everyone. I'll be tackling this topic a little bit from perhaps a little bit different angle than the other speakers. I've spent the last 20 years working in public health institutions, both in Europe and globally. And during this time, I've seen a sea change in how health information doesn't just provide information to people about their health and how they protect it. In health and in general, we've faced intensified challenges to providing health services and prevention programs because of the digital information environment that affects actually all parts of society and all countries globally. It's harder to address confusion, it's harder to address rumors, misinformation, it's harder to provide credible sources of health information to people who receive and discuss information in this hybrid online-offline world that they inhabit. And this makes the job of public health or organizations actually that work in health much harder to serve different populations. So a lot of people jump to the conclusion that we can just fact check the internet or use Facebook ads to promote healthy behaviors. But these are short-sighted and don't really consider how digital spaces are rigged to monetize outrage and aggression and misinformation. We need to remember that people who profit most from everyone having a phone in their pocket, they do so because they're selling something. They're either selling an ideology or a product. And some people think this is just a problem of high-income countries or just people who have internet access. But the world is shrinking and everyone's coming online. In fact, right now, for example, Starlink is connecting people living in the Amazon who, until very recently, had limited contact to the outside world and now have high-speed internet. And they're experiencing a shock to their society, one which is happening over the course of weeks and months. And in places where the internet has been available for longer, this journey has taken a few decades, but the end result is the same. We can't dismiss this as just a problem of wealthy nations. Everyone's affected, and it enables also political and social dynamics to be exported across countries, across borders, and influence other parts of the world. So I'll give you some examples of how we're facing completely new challenges at the intersection of sexual reproductive health and rights and technology in society. These are all news headlines from the past year, and they're from about topics from all over the world. One, it's easy to download a free app onto your phone, but do you know where your sensitive health data from this app goes? Apps that help women, for example, track their menstrual cycles are selling that data to advertisers and health insurers and marketers. And in some countries, this type of data, it can be used to build a criminal case against a woman who is seeking an abortion. And in other countries, it can be used to extort and harass LGBTQI people. The second issue is that we trust tech platforms to deliver health information to us. But both Google and Meta, for example, they change what reproductive health information shows up when we search and use the platforms based on what country we're from and what language we use. So that means that the private sector companies end up influencing types of information people see and quality of information available. So companies with no localized knowledge of sensitive health issues or knowledge of stigmatizing health issues are determining what health information we see. That also means that whoever wants to scam and influence or sell political agenda has the knowledge and also has the knowledge to optimize their content. They can outperform anything we do in public health unless we get our act together. And that goes way beyond us running shiny campaigns online. And some of the panelists mentioned how important it is for bottom up and community organizing on this. And then the third issue is that there's a growing organized opposition to sexual reproductive health and rights. And this opposition has gotten much better at using digital spaces and political spaces and networking to drive political and societal influence globally. So they've become adept at driving people's eyeballs to content that is opposite of credible and accurate, which is promoting potentially harmful offline action. I call this problem, all of this, a problem of the information environment, because it's not just a community problem, it's a systemic problem that comes out of social dynamics, the increasingly modern digitized society that is also politicizing health topics. One other thing to add here, we know much less what is happening in low and middle income countries context about all of these, because most of the evidence that we have and information that we have comes from high income countries. So we need to do a lot more investment into learning from communities across the world, into research on digital information environment and sexual reproductive health and rights to understand and quantify digital harms and identify the solutions. So what can be done to improve advocacy and accountability in this new digital context? I prepared slides that are busy with text, and because I wanted you to basically to go away with some ideas you can screenshot and think about after this webinar. So I apologize for text heaviness, but I will offer 3 strategies for what can be done at 3 levels. One is community, the other one is health system and government, and the third one is societal. And many of these strategies are built on what's been done or has been built, or they've been borrowed from other health topics, but may be useful in the context of sexual reproductive health and rights. So here, for example, one challenge is that is intensifying is that individuals and communities are still finding it difficult to find, search for, and act on credible information in sexual and reproductive health and rights. And because of these digital dynamics, they're also a lot more exposed to health misinformation, and they're a target of misinformation narratives. So I propose these 3 possible strategies. If you're already doing this, get better and share your experience and knowledge with other advocates. And if you're not doing this, consider how this digital context might be affecting your community and how these actions might help. So I've seen that the best strategies are proactive, like not only chasing misinformation, but also in parallel providing accurate, credible health information. Or, for example, increasing digital and health literacy in the community. So we promote resilience to deceptive marketing and misinformation and also digital harassment. So the second part is, I also think we need to think about how public health professionals and health systems need to respond to these challenges. I've worked all my career in public health organizations, and one thing that is clear is that we work in workplaces that are often staffed by people who have not grown up with the internet, and they don't understand how it is a social construct. It's not only just used for broadcasting information into the ether. So, for example, the average age of people working in senior positions in the United Nations is around 55 years old. So we need to speak up, public health professionals, we need to speak up the hierarchy to leadership better, and also think about where our blind spots are in our system. So these are 3 potential strategies I suggest, specifically to mis and disinformation and hate speech in health. 1, we need to resource and get better at digital engagements and addressing questions from communities. 2, and this is really a big point, it has 2 points, 2 parts. We need to equip our staff on digital media misinformation and how to talk to clients in digital spaces. And on the flip side, we need to protect them better from online harms. Most countries in the world lag behind protecting their workers systematically against this. For example, from harassment and bullying just for doing their jobs in health. And there needs to be a more systematic collaboration with civil society to understand and mitigate the harms caused by organized anti-health groups. We need global and local, so G-local and systemic action here. And then lastly, I think it's not just on civil society, communities, and health system to address misinformation, a lack of digital information, or, for example, the organized opposition to health. We need to keep working on ways to strengthen the societal conversation and also societal norms so that they support LGBTQI health and rights. So here's my 3 suggestions. Again, if you're already doing it, do it even better and share your experience with others. And if you're not doing it, consider how this applies to your context. So, for example, working with and training journalists on how they investigate and cover LGBTQI narratives, using existing coalitions to consider digital outreach, education, and social norming, or, for example, leveraging partnerships with academics to generate the evidence we need for advocacy and policy change. So lastly, I did a bit of a thought exercise a while ago about what we could do about health misinformation. You can read more about it on my blog. I linked here on LinkedIn. But the bottom line basically here is that we shouldn't underestimate how much the digital environment nowadays influences our own health decisions, our access to health information, and therefore the success of our advocacy. And accountability of health programs to communities. It's not just misinformation and hate speech that is the issue here, but other systemic and structural challenges. And the bad actors have a much easier time exploiting this digital environment compared to us. So we don't only want to respond, we need to keep up with the advocacy on this. So I think in the long term, sustained solutions are those that focus on prevention and resilience. And literally, just to conclude here, really, when we will only succeed in better measurement and better advocacy, etc. And I'm speaking now from also as a public health professional. We need to involve and partner with you, with community organizations, with civil society, much better and much more. And continue and building on the legacy of the response to the HIV pandemic in order to get much better also in responding to the digital threats. So thank you very much.
Thank you so much, Tina, for your presentation and kind of leading us very smoothly into our Q&A session. I know that we are on top of time, so we might be able to get to only one question. I also see, thank you so much, Ralph, for answering one of the questions over text. So you can also read that as well. The question that is in the chat right now is, what would be an effective strategies to advocate for inclusive health facilities for sex workers who use drugs? And anyone who wants can feel free to unmute and answer that question. Yes, go ahead, Ralph.
Yeah, I guess there's no specific strategies that we could identify right now, and I always believe on accountability to affected population, or a dialogue with the sex worker. So basically, in every country we have a different context on how sex workers are actually behaving, or where sex workers can be found. So basically, the most important thing is we really need to have a community dialogue with them in order for us to identify where can we see them, where can we engage them, and basically they themselves can identify what are the possible solutions that we could, they themselves can better identify what are the possible solutions to address their key issues, rather than us identifying their strategies on how to engage them. So it's about giving those freedom within the community to identify possible solutions for them. Thanks, Bukola.
Thank you so much for answering that question, Ralph. Tina, did you also have an answer?
Yes, just to build, I think Ralph actually did a great job. I was too late raising the hand. I absolutely agree. I would even suggest one step further. So everyone that seeks health services goes on a journey of interaction with the health system, and not only would we need to include this the different populations in the design of the health services, we need to also include them in the evaluation. Are we actually delivering what we promised in ways that are acceptable and aligned with what they need? So participatory design and evaluation of health services, probably one of the best strategies to ensure that your health services are actually delivering on what you say or what you intend to.
Yes, totally agree. Thank you so much, Tina. Did any of our other panelists want to answer that question or have any thoughts?
Yes, please, but at some point my network was breaking. Can I also get the question again, please?
Yes, of course. So the question is give me 1 second. So the question is, what would be an effective strategies to advocate for inclusive health facilities for sex workers who use drugs? Hubert, did you have a comment? I saw that you unmuted.
Yes, I just wanted to add something because when Ralph was speaking, I got a little inspiration because also talking about disasters, and Morocco also has had an earthquake like lately last year, and thanks to our partners, especially Love Alliance through GP Plus, and also Outright were really supportive, and we had the chance to support financially the people who were impacted by the earthquake, but also to organize a gathering like a sort of hackathon in order to speak our needs with each other, and also to say that we are here together even in situation of crisis. Because with us there was people who are families were lost and lost their families, and people who were in really difficult situation, but just gathering together through the support was really important. And from then we took it in order to get some financial support, like for mental health or basic needs, and this is very important to us. And that for that we would love to thank our partners, but also thank you for the opportunity here to share what we are doing and who we are. Thank you.
No, thank you so much, Ruba. Go ahead, Mary.
Oh, all right. Thank you, Yubar. Thank you, every other panelists. So just to quickly answer the question, first of all, I will talk about community engagement. So involving sex workers who use drug in the design of implementation of healthcare services, any services that you are willing to render to the community. One of the things to do, one of the strategies that would really speak volume and would be involving is community engagement. Engage them from the design of and then the implementation of that service. Then talking about stigma reduction, conduct training sections for healthcare providers to promote empathy, understanding, see how you can also work around harm reduction programs, such as needle exchange programs, safe consumption sites, and also trauma-informed care. Let's ensure that healthcare services or healthcare providers who provide services for sex workers who use drugs are trauma-informed and also addresses the history of traumas that maybe many sex workers or individuals must have experienced, and then see how collaboration, you can collaborate with other healthcare departments, NGOs, community-based organizations, advocacy groups, leverage on their resources, their expertise, and see how you can advocate for safer healthcare services for sex workers who use drugs. Thank you very much.
Thank you so much, Mary, for that contribution. Thank you all so much for just all of the insight. I know I learned a lot from everything that you guys have spoke today about your experience, about your country's experience, as well as key strategies and advocacy that we can all take home. So thank you all so much again for your presentation and for being here and for sharing your expertise with us. Without further ado, we are at 9:06. If we don't have any other questions, thank you all again to our participants for joining on today to hear our speakers and hear our panelists for everything that you guys that questions that you guys asked and for just being engaged throughout our webinar. So without further ado, again, I say thank you to all, and I hope you all have a great rest of your day. Bye-bye.